This is a recording of Dr. Chalmers Live for Sunday, December 26, 2010. You can listen to Dr. Chalmers Live every Sunday from noon to 1 p.m. right here on 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Guess what? I am live in studio. Even though that it's only the day after Christmas, we're here and always here for your listening, but also for your information source. If you have a problem and you've tried everything that you know what to do, maybe I can put a different spin on it for you, a different light. Maybe we can answer some questions that actually might help you along the way. Waiting for your phone calls today at 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. We're going to talk a little bit about a magic bullet, if you will, something that can reverse the aging process, something that you can actually do on your own, doesn't cost you anything to do, and you can actually take years off your life. Wouldn't that be great? And also maximize your body's normal rhythm, your capacity to grow older but not be old in any way. Well, you know, we're all going to leave this planet at some point. Nobody's getting out of here alive. But wouldn't it be nice to be able to live maximally, to be able to prevent things? If you go back and you read old textbooks of Vidal Davis and Carlton Fredericks and some of the old stalwarts in nutrition, as you read through, you'll get the idea, and they actually come out and say it, that if you're going to cheat on something, occasionally cheat on your diet. Once in a while, get something that you want that you know you shouldn't have. And I'm saying once in a while. I'm not giving you carte blanche to go out and do whatever you want to do and throw all kinds of junk in that body of yours. But what they say is never, ever, ever cheat on your exercise. Life is activity. It's motion. It's the capacity to do and to have strength and to be able to do things. Well, there's a lot of research that is being done ongoingly about the effect of exercise on aging. Years ago, I went to undergraduate school at Kent State University in Ohio, and they did a research study, and this goes back many years ago. If I tell you exactly how many, well, we'll talk about at least 40 years ago. And the research study was done on guys who had had heart attacks and strokes and had significant hardening of the arterial vessels. And they began a study that said if you do, and their theory was aerobic exercise, trying to transport oxygen back into the tissue, that the body would respond by increasing its vascular supply, its blood supply, and also begin to reverse some of the plaquing. Some of these people, as you can imagine, after they had these problems, couldn't even walk 100 feet, let alone begin to walk 2 and 3 and 4 and 5 miles or run those miles. And so they started these guys walking 20 feet, 15, a little bit more than that, 50 feet and so forth. And the short end of the story is simply this. What they found then, even then, is that slow exercise, slow movement over a period of time began to, what they thought would happen, increase the circulatory pattern where they had these guys out walking, and not only walking but running and getting off of medications and increasing their collateral circulation to the place where they, in many cases, got back to where they were prior to the stroke, prior to the heart attack, and they were impaired. Exercise is king when it comes to begin to transform your body's health, and it doesn't take long. Do you realize you could exercise in 20 minutes if you did it every day? I've told you, those of you who've listened to Dr. Tom Roselle Live, that if you did nothing more than walk 2 miles every day, just 2 miles, just go out and walk 2 miles without stopping, that you will decrease your risk of dying from any kind of disease process by 50%. That's huge. That's absolutely huge. 50%, your risk of dying from any disease process. Doesn't it make sense that you would want to do that? Now, see, I'm setting you up, right? Because what's coming up in a week? The first of the year, 2011. And I promised you that next week we would talk a little bit about setting goals. So I want to give you something to think about and the beginning stages of how we begin to transfer information into application. And that's what we're going to talk about next time that we get together. Now, let's talk about this hormone that is so magical in the body that a lot of you think about, and many of you have gone out and spent a fortune buying it, sometimes illegally, and injecting it. It's called growth hormone. See, after you hit a certain age, and that age is in like 20 years old, and 21 to 25 years old, growth hormone begins to go down the tubes. It doesn't produce the levels that it did prior to that. So we begin to hit a maximization level, maximizing what we have at that point, but we don't do much more than that after that. Well, there's a way of changing that, and there's a lot of studies out, a lot of references now that says that is true. So we're going to talk about the phenomenal anti-aging power of certain types of exercise, and kind of flies in your face to what some of you are doing. A lot of you go out and just run, and you get into a zone, and you keep your heart rate real low, and you think that will reverse the aging process. Well, in some situations, when you do too much of that, it actually works against you and breaks the body down even more. So is exercise good for you, or is exercise bad for you? The short answer is exercise is good for you, but certain types of exercise aren't going to maximize what you're trying to get done. So we want to talk about the effects of aging in relationship to exercise. And I think that you're going to find it fascinating. It's very applicable to what you need to do for yourself coming up 2011. Our number here is 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject you have in mind. Want to remind you that Dr. Tom Roselle Live is brought to you ongoingly by several supportive people, many of our wellness partners, but one in particular, and that's the Thermography Centers of Fairfax. And they want us to remind you that coming up in January, to start out the new year, and they want to encourage you to add thermographic imaging, one of the best pieces of diagnostics that you can add to your annual physical. This January, they're going to allow you to receive a full-body thermographic examination, normally $475, for only $400. That's huge. Thermographic imaging can show all kinds of things way before any other type of examination mode will show it up. Inflammatory reactions, hardening of the arteries, cancers. This is something that's a must. I'm going to have it done. I'd encourage all of you to make sure that you incorporate it as part of your annual physical. Give Thermography Centers of Fairfax a call and ask for Dareth Painter at 703-943-7248. That's 703-943-7248. And ask Dareth to give you the information on the January special for thermographic imaging. That's Thermography Centers of Fairfax, 703-943-7248. Let's talk about exercise and what you can do to make a difference. But I want you to understand the mechanism here. We're talking about your chromosomes, your genetic makeup, and how you can alter your genetics. That's right. You can really alter genetics. It's been proven over and over again. But how do you actually go about doing it? Well, if you've listened to me in any of my lectures, when I do talk about reversing the process, there's something called on your chromosome, that blueprint, if you will, that makes up you, is something called a telomere. And telomere is your genetic code. It's your individual code. And at the moment of conception, not even birth, at the moment of conception, your telomere length, and we're just going to say units, is 15,000 units. Now, over time in your life, that telomere begins to shorten up. I mean, physically reduce in size. And as it does, you grow old, and then it gets to a certain place, and then you die. And when it gets to 5,000 units, scientists say that that's when you die from old age, providing that you've done everything right. So how do we put off age-related death if it's too soon? Well, there's ways of doing that. We want to take a look at how we can influence that telomere, that end little piece on either end of the chromosome, as it relates to what we can do around it, to it, and for it. And in this situation, we're going to talk about exercise. There are many studies out there, and the results are tremendous, and it's related to regular, vigorous, aerobic type of exercise and maximal aerobic exercise, and how it relates to the aging process of us, human beings. And what we've noticed is that if somebody exercises regularly, and they do interval training where they do short bursts of high-intensity type of exercise. They can either do it by strength training, they can do it by running, but it's that type of exercise mode that actually seems to have an effect on these telomeres, these end pieces of the chromosome. And the results indicate that if we can preserve these telomeres from shortening up too soon, that we can extend not only life, as long as it's consistent with the normal cycle of aging, but we can also maximize health. Kind of interesting, right? Do I have your attention? Well, I should. So what do we want to do? We want to look at the type of exercise, and I'm going to teach you that today. I'm going to teach you the type of exercise that you need to have, how it can relate it, and no matter where you are and no matter how old you are, you can begin to do this slowly if you just said, you know what, 2011 is for me. I'm going to maximize who I am and what I do, and I want to increase the capacity of my body to live longer, but also, more importantly, to live well. So to do that, we've got to somehow stimulate the reaction of growth hormone in the body. And a lot of you say, well, I don't have it. Well, you have 20 minutes a day? I think so. And actually, it only takes 20 minutes, maybe twice a week. Twice a week, that's it. You got 20 minutes twice a week? I think so. But this is not to set aside other types of exercise. As far as I'm concerned, and my experience over time, is that you have to do multiple types of exercise to maximize your body's capacity, strength-wise and so forth. Interesting study in the Journal of Sports Medicine, and this came out actually several years back, and said that exercise intensity above a certain level and for minimum 10 minutes appears to bring about the greatest amount of stimulation to the secretion of growth hormone. And now we're not talking about injecting anything. We're talking about exercise. And there's actually a supplementation also that will help you, and we're going to talk a little bit about that, and I'll tell you what it is as we go on. And so the combination between certain type of exercise, a certain nutritional supplementation will maximize your capacity. So here's the deal. There are two primary anti-aging effects created by certain types of exercise. One of the things that we want to do is we want to reduce the shortening of this little substance I just called a telomere, right? We don't want these end strands. Visualize them as this little barrel, these two little threads, and they're paired threads on either end of this barrel. And this is your chromosome with your telomere, which is your blueprint for who you are. So we want to reduce the shortening effect. And then also we want to increase the production of human growth hormone. Big order, but guess what? It's totally possible for every one of you listening to me. It's possible. So pay attention, because we want to make this effective for you. So you need to understand what it is that you're doing, and then we're going to go on to the process of what to get done. See, I'm one of these guys. I'll sit in a class forever, and maybe 3, 4, 5 days of listening to these speakers drone on and on and on. And what I really want is I want that end piece. I want to know what it is, how I can use it, how I can apply it to my patients, and so forth. So you get the benefit of my sitting around and reading all this stuff and sitting in these classes, so I can give you the nitty-gritty, so to speak, on how to turn this whole aging process around if you decide that you're going to do it. So what we're going to do is we're going to figure out how to shorten or stop the shortening of the telomere, which are these strands that have your genetic blueprint. And remember, the faster they shorten, the faster you're going to leave this planet. And the second thing we want to do is we want to increase human growth hormone, your own, so you can maximize your strength, your endurance, your capacity, your ability to live well. Good idea? I think so. You're listening to Dr. Tom Roselle Live. I'm here at 888-630-9625. 888-630-WMAL. Love to hear from you. Let's talk about whatever you'd like to talk about, and I'm talking about how to turn around your muscle mass and get you to live longer and more healthfully and more productive. Isn't that a great thing? You know, every time you come to lecture, I tell, let's figure out how you can live 10 years longer and reverse the aging clock. Well, this is the secret. This is the way you do it yourself, which, by the way, is the title of my book. That's right, Ageless Health 101. Health is a do-it-to-yourself program, and we're talking about what you can do to yourself. By the way, that book will give you the guidelines and help you make decisions and give you the blueprints of how to really affect your health beneficially. It's a must-read. It's one of those things that for 2011, you have to make sure that you read this book. And you can get it either from our website, rosellecare.com. You can go to Amazon, and soon to be on Borders. So it gives you 3 options of picking it up. Also, go to rosellecare.com, but also on Facebook, you can go to Roselle Center for Healing, and you'll find us as well. Lots of information there. We try to publish something new all the time to help you, but check us out. You can go to one or the other from one or the other place, rosellecare.com, and find us and follow us on Facebook. We're talking about anti-aging. We're talking about very specific